everybody. Today we're going to be stretching a child. This is Michael, my son.
Hello.
All right. And so I'm going to swing over. Hey. So we're going to start stretching the upper body. Now, as your children grow older, as the bone extend because they're growing, the muscles will get tight. And so kids that have no problems like Michael, who are athletic, they tend to get tightening in the muscles. But then these stretches are very good also for children with cerebral palsy. We're going to start with the upper limb. Now we're going to do this in real time so you can follow along, okay? So we're going to start with the upper limb. Use one arm, put the arms on by your side, Michael. Thank you. You're going to go over the head, right? You're going to go back and forth a few times, counting to 30, right? And then you keep it in position. All right, we can also do extension of the elbow while we're doing that. Down and up. We do that for 30 counts. Now, we do it on the other side. Similarly, over the head. This is shoulder flexion. Going forward, flexion of the shoulder. All right. And you go 1, 2, all the way over. So you're stretching. See, sometimes the elbows in children with cerebral palsy are very tight. So you have to push and extend the elbow and then go over the head. Count to 30. Now we're going to do abduction, which is sideways. So we're going sideways, right? So we're going out, right? In and out. We're counting to 30, right? A lot of times you get tightness in the muscles right here by the pectoralis. You're counting to 30 on that side. And now we go to the other side. Anything you do on one side, you do it on the other. You stretch and push it out. Again, if you have the biceps tendon, can be quite tight and spastic in children with cerebral palsy, you might have to push a little bit. Sometimes you may not get all the way, but you go as far as you can and you hold it and you count to 30. All right. Sorry, I didn't hurt you. Sorry. Now we're going to go across the body. We're going to do the adductors. So we're going across the body. So we're going across the body similarly. Keep extending and flexing the elbow. So you're going across. All right, what I just did was pull the shoulder down so I can go across. Because going the shoulder up, you're not stretching the neck muscle. So pull the shoulder down and go across, right? All right, same thing again. Whatever you do on one side, you have to do on the other side. Same thing again. You're going across, head straight ahead, Michael, looking straight. Bring that shoulder down and go across. And go across. Count to 30. Across. Now, we can also do the adductors by lying on your side. Lie on your side, Michael. Face forward. All right. So this way, we can go that way. We can also go a little bit further backwards with that. Now, if you notice, I'm holding this shoulder, pulling it down, and stretching backwards at the same time. All right. As far as you can go comfortably with your child. This is extension. So we're now extending. So remember, we started with flexion. Then we did abduction, then we did adduction. Now we're doing extension. So you get in the full range of motion. You count to 30 on that side. Turn and face me, Michael. We'll do the same thing on the other side. Okay, bring your shirt down. Hold the shoulder down so you're stretching the neck muscles at the same time. And you're going backwards. All right, so just be careful you don't hurt the child. Again, we're stretching backwards. Sometimes the elbow was so tight, you're not able to go all the way. But support the shoulder and you go backward. All right, feels good? Lie back on your back again for me, please. All right, so now, just going down the arm, a lot of times the wrists will get very, very stiff. Similarly, you have extension of the wrist, flexion of the wrist. Sometimes the wrists are tight going into flexion. Fingers are tight as well. So the best way to do that, keep the elbow straight, kind of flattened all the fingers and go up. You count to 30, right? Whatever you do on this one side, you do on the other. Again, straighten your elbow. You're stretching the wrist flexors. Again, if the wrist is tight, you have to keep the elbow straight, fingers straight, and go all the way up. Count to 30. Now we move down to the fingers. Sometimes you'll have the finger in thumb where the fingers are very, very tight. And all you do with that, with those children, that the fingers are very tight, you just extend as much as you can and you pull back, right? So here you can see it, pulling back. and you're counting to 30. So you bring the thumb away from the other fingers and you're extending while keeping everything straight. Do that for 30 seconds. Same thing on the other side, right? Keep the fingers straight, thumb away from the others, and you extend the metacarpal phalangeal joint, which is this joint right here, right? Do it as much as tolerated. So more or less that will cover the upper limb, but just to add something for the neck, sometimes the kids are really, really tight in the neck, so you may want to stretch them to the left, gently, stretch them to the right, gently, bring the head up, gently, right? And then I'll sit him up in the end and we'll do some neck exercise, or you can look at one of our videos for neck range of motion. Now, we're going to do the lower limb now, right? We're going to do the lower limb. So slide up a little bit, Michael. Perfect. All right. So, as children grow, Michael in particular, the hamstring gets tight. So we have to stretch the hamstring. So the hamstring is that muscle that goes from the hip. Right, so let's do this one. It goes from your hip and it inserts proximal on the leg bone. So you can stretch the hamstring like this, right? So, right, there's something where you can actually, if the child can help you, you can actually ask the child to push down, all right, and you stop. You can stop now, and you notice you go a little higher, right? Point your toes straight to the ceiling, Michael. So his toes were actually turned out. You want the toes to be pointed to the ceiling. So push down, 1, 2, 3, 4, 5. He's very strong, okay. You notice he's going further. That's what we call that PNF, right? So keep your bottom when you're pushing down. Push down, Michael. 1, 2, 3, 4, 5. Stop. You notice that's called PNF. That's that helps the muscles to relax, and it actually does work. Push down. 1, 2, 3, 4. Stop. You see how far he is? And that's not where I got him. That's not where we started. We're doing the same thing on this leg now. That's as far as he can go. It hurts, right? Watch. Look at this miracle. I always want to keep the other leg down. Push down. 1, 2, 3, 4, 5. Stop. Okay, push down again. 1, 2, 3, 4, 5. Stop. Okay, you see that? It's relaxing the muscle. Push down again. 1, 2, 3, 4, 5. Good. Stop. See that? And last one. Push down. 1, 2, 3, 4, 5. Stop. Okay. So now, let's see if we can get a little bit more range. See if we can get him to 90 degrees. Push down. 1, 2, 3, 4, 5. Stop. Remember to breathe. All right. So see that? So it actually remains. Look at this now. Before we couldn't get him all the way up there. That's called PNF. All right. So now, straighten up your butt. Straighten this way. All right. Good. So now let me show you what you could do with a child that cannot help you. A child that cannot help, usually, when you get to here, it's stuck, right? A child that has cerebral palsy, it's right here is as far as you can go. So really and truly, what you need to do is to kind of stabilize this leg. Come over some more towards me, Michael. Okay, good. So you stabilize this leg. Don't press too hard, and you extend. So he has now, his flexibility is a little bit better. But the child with CP, try not to squeeze the Achilles. You're just extending the knee, and you count as best as you can to 30, right? You do that on the right. Okay, do it on the left now. Always toes straight up, stabilizing this side, and pushing up. He lost it. Let's see if we can get back the extension. Push, down, stop. Point the toes to the ceiling. Push, stop. Good. All right, good. Again, the child with less flexibility, keep this leg down. I actually put my leg on his leg to hold it down and extend, right? So you can do ballistic stretch, which is this, or you can do the more sustained stretch, but you count to 30 each time. That's for the hamstring. Good. Now, after the hamstring, you have the IT band, the iliotibial band, which goes from your hips all the way down to below the knee. So the IT band will go across like that. His is quite tight, right? So you can stretch it across the body. You count to 30 on the left, You're getting a good workout today, Michael.
It hurts.
Sorry. And you go to 30. All right. So now we're going to come down to the calves. The calves can be quite tight, and in athletes, tight calves will give you shin splints. So you want to stretch the calf. First of all, you want to ensure that the foot is in line with the leg. So you don't want the foot turned in, inverted, or out, everted. It has to be sagittal, nice and straight. So you want to push up and you count to 30, stretching the calf, right? Similarly, you do it on the left side. Toes straight, and you push up. You count to 30. Sometimes you can actually, if the children can help you, you can have them get a towel and pull up, like a stretch rope or a stretch out strap, and you have them pull up. So ensure that they're not pulling this way, inverted, or they're not pulling out, everted. They're pulling straight up, and you can feel the pull going straight up. So when the knee is bent, you'll get a lot more range at the ankle. But you don't want that because the gastroc muscle starts in the thigh and it goes to the calcaneus, which is the heel bone. So when you bend the leg, you're not quite stretching it to its fullest. You want to be able to keep the knee straight and pull. Feel that pull? Feels good, right? Count to 30 and do this side again. Again, you do not bend the knee, because once you bend the knee, you take the pull of the gastroc muscle. You want the knee straight, so you're stretching the gastroc muscle and you pull. Very good. So now sometimes the kids with cerebral palsy will have curling in their toes. Again, similar to what you did with the fingers, you just put your own fingers around the toes and you just pull them up. Toe extension. So you're just extending. It's always important to extend, because sometimes when the kids stand, the toes will curl and you don't want that to happen. So you're extending the toes just like that. Feels good? And then you extending the toes. So even, as I said, even children who do not have cerebral palsy, like Michael, they get tight. They get tight in the calves, tight in the toe flexors, tight in the everters, tight in his IT band, iliotibial band. Now, that is the front. Now we're going to stretch the hip flexors. Turn over on your tummy, please, Michael. Come over to me. All right. So there are two sets of muscles that we can stretch. We can stretch the quads, which is the muscle in the front of your thigh. We can stretch your hip flexors, which is the iliopsoas muscle. So the first thing we want to do is bend the knee. So you can feel, so when it's definitely tight, once you bend the knee, you see the hip rise off the bed, just like it's rising off the bed here. So his hip flexors are tight, and so are his quads. So let's stretch the hip flexors first, which are the ones up here. So you first have to stabilize the pelvis, because if you're going to lift up, it's going to lift off the bed. So you stabilize the pelvis with your hand very comfortably. Okay, Michael? And then you lift up and you count to 30. Now the same PNF we can do with the hip flexors that we did with the hamstring. So ask him to push down his knee in the bed. Not yet. Go ahead, push down. 1, 2, 3, 4, 5. Stop. See, I get a little bit more movement. Push down again. 1, 2, 3, 4, 5. Stop. You see that? So you do that. That's called PNF. That can give you some stretch of your hip flexors in the front. Same thing you do on the right, you do it on the left. You bend the knee. We're doing the hip flexors, not the quads. We're going to do the quads shortly. Same thing. Stabilize the pelvis. Bring the thigh up, stretching the hip flexors. Again, we can have him push down in my hand. 1, 2, 3, 4, 5. Relax. Pull up, push down. 1, 2, 3, 4, 5. Relax. So PNF is such a wonderful thing. It allows you to do contraction and relaxation of the muscle you're trying to stretch, and that will give you a little bit more range of motion. That was for your hip flexors. Another way to stretch your hip flexors, we're going to come back to your quadriceps muscle. Go up on your elbows, Michael. So some children, if they can help, they can go up on their elbows and they're stretching right here. Others can go up on your hands, and they're stretching right here. I count to 30. Feels good. That's a very good stretch, Michael. Good job. Come back down. Let's do it again. One more time. Stretch the hip flexors. Open your hands. One more time. That's elbow, and now on the hands. You're stretching your hip flexors. Good job. All the way down. Now we're going to stretch your quads. So you're going to bend. So the quads, again, are the muscles in the front of your thigh. Before we stretch the hip flexors, now we're stretching the quads. So we just push. Now, how do you do the PNF with the quads? Straighten your leg, Michael. Down here, push out. Push out. Up here. Push.
Which way?
Down to the, push against my hand here. Push. 1, 2, really hard. 3, 4, 5. Stop. See that? Push again, Michael. Push really hard. Hard, 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 hard. Push, 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 push. Stop.
My knee.
All right. Sorry, lady.
That's what I got.
Right. And so now, just on this side. That's as far as he goes. Now we're going to ask him, push down. 1, 2, 3. Stop. You saw that? Amazing. Push again. 1, 2, 3. Stop. So that allows us to get more range of motion in the quadriceps muscles. The last set of stretch I want to do, turn over onto your back, Michael. You're going to bring both knees to the chest. We have to stretch out the spine. So sometimes the children go up on the bed just a little bit. Perfect. Sometimes the children can help you bring both knees to your chest. Hold it real good. Pull it up. They can do that to help you. Pull. And they can count to 30. Good job. Hold one leg down. Hold this leg with both arms. As best as possible. Try to see if you can bring it down. Count to 30. Good job, Michael. And alternate. Next leg. Bring this one down. Try to make sure they're kept straight. Good job. Excellent. And last one. Sit up, buddy. And try and touch your toes. Right. And to top it all off, the very last one we're going to do will be the muscles in between the legs, the adductors. So come up a little bit more in the bed. Perfect. Put both legs together. We're going to push out. Children with cerebral palsy are very tight in the middle. So you may want to either sit on their leg and push out because the legs are going to be sliding down. So you push out. You can either do this lying down or sit up. Or they can push out. Push out. See that? That's a very good stretch. That's it for now, guys. We just showed you how to stretch a child. Bye.
Bye.